Physicians are held in high esteem. We are put on a high pedestal. But we are human beings. We really need to touch the lives of our patients. We are caregivers, but what is the care in our profession today? We really need to look at that. When we look at the human being as whole, the human being is consciousness. We are all spiritual beings. It is the mind which influences the body. Today we have psychoneuroimmunology, how the emotions affect the nervous system, and that in turn affects our Department of Defense, or the immunology. We have seen mind can really create miracles, but mind really looks within, and it does influence the whole system. And then is our physical system, the organs and the structures, the anatomy and physiology which we read throughout our courses. We really, the holistically, now it's not holistic medicine, but it is holistic living, sustainable living. When Mr. Kakodkar was talking of environment, what have we done to our world? We have really depleted it. We have been greedy. It is our greed which has really created the disaster for us, or the crisis for us today. So likewise, when medicine is depleted of that consciousness, that spirituality, then we really come to that mechanistic or reductionist kind of treatments. We have an anomaly from our Vedic literature. It is the intellect which is the rider. There is always something, when we think of something and we really do, is the intellect. Intellect, when it becomes divine, when it is able to discern and discriminate, when it is able to get rid of the wastage, it is not the thoughts which are harmful, but it is the waste, the negative thoughts, which intellect really discerns and really knows where to do what. And discursive mind. Mind is like a child. Whatever you find interesting, it wanders around that. When a child has a knife in its hand, we don't really try to get it out of. We give him something interesting and he leaves the knife. So when the mind is given something interesting, it would leave out the negative and the useless. It's like it has to be reined up. And the senses are like horses. And the objects are the desires on the road. So Upanishads tell, when we are in harmony, when the self is joined to the body, mind, sense, but he enjoys, we are the masters. It is the sense of control which comes to our lives. We are really wandering. Why we are wandering? We are not focused. But once we are in harmony with ourselves, then the whole world is good to us. It's only when we are not established in ourselves. If you look at the word swasthya, what does it mean? The swasthya, the one who is established in himself. And if you look at the word health, it is the heal thyself. So basically health is, we doctors are used to looking at disease. We hardly see a healthy person. Health is someone which is really the domain of the self. We need to really look after ourselves, and no one can be better doctor than our own selves. You need not really, some people may not really adhere to the conventional religion, but they can still be spiritual. And religiosity is more broader, institutional and ritualistic. The World Health Organization, this statement came in 2006. It clearly states that health professions have largely followed a medical model, which means a symptom, a cure. But when we go to our chronic diseases ward, we know we have people living with diseases. We have now, people, we say that you have to accept that you have a problem and you have to live with the problem. It's not like the old times, you give an injection, you give a pill, and there is relief and people are cured. And there's difference between curing and healing. Healing is restoring the soundness, restoring the person to whole. Now even we have just stopped thinking about death. dying in hospital. People are burdened with interventions and treatments. More and more people are living good lives, but then if we see that if they are able to talk to their physicians, probably they would be able to decide how they would like to die. And now the patients and physicians really need to realize that the value of elements such as faith, hope, and compassion in the healing process. That needs to be researched into it. And I'm sure that this conference is path-breaking. No one would talk of spirituality in medical conferences. But now it is people who are writing about meditation, the therapeutic benefits of meditation. And what does spirituality mean? There's so much happening in the medical field. We are stressed a lot. We come into interaction with stressed people and we catch some of the stress from them also. We know people when they come, they have grief, they have pain, they have suffering. And that suffering they leave with us also sometimes. In comparison to that, if you look at this report, which only appeared on 12th of January in 2008, and this has been published in the Journal of Association of Physicians of India. If you look at the doctors, if you look at the lifestyle diseases, the percentages you look at, the doctors have more diseases than the general population. This is what is lifestyle.